Can you overdose on Suboxone? Managing your opioid use disorder is a challenge in itself. However, the last thing you want to worry about is the likelihood of an opioid overdose or whether the prescribed medication to treat your opioid addiction could potentially result in an overdose. Opioid-related overdoses have been on a steady incline recently, with prescription and synthetic opioids topping the list of most lethal illicit drugs. As a result, more people die from overdoses than in car accidents. While Suboxone is an FDA-approved prescription medication for the treatment of opioid dependence, there are still some concerns about the potential effects of Suboxone. This video will answer the question, can you overdose on Suboxone? Tolerance happens when the body is used to a specific dose of opioids and no longer reacts to it the way it did when you first started using it. As your tolerance increases, you need more of the drug to get the same effect. According to the American Addiction Centers, drugs like prescription opioids can lead to tolerance. It means the opioid receptors in the brain get used to the artificial painkiller or any other potentially abused prescription medication and does not block the pain signals any longer. More and more people are developing a tolerance to drugs like heroin and fentanyl. This means that when they take the same amount, it does not produce the same euphoria as it originally had. This can cause an addiction-related overdose because you're taking even bigger doses than before just so your brain feels that same high. While Suboxone overdoses are rare and low in number, it is possible for those who have a low tolerance for opioids to overdose on Suboxone. That is why it is vital to have a certified medical professional assess you before undergoing Suboxone treatment and guide you in taking Suboxone. With the help of modern technology and advancements in communications and health services, access to medical assistance and treatment programs is now at your fingertips. Suboxone is a safe opioid addiction treatment medication that most patients can use. As part of medication-assisted treatment and dual diagnosis treatment, Suboxone is normally prescribed with behavioral therapy and other forms of rehabilitation to ensure its effectiveness. Finding a Suboxone treatment center can be challenging. At Suboxonedoctor.com, we make the process easy for you, guaranteeing you will find the best qualified and compassionate Suboxone doctor suitable for your needs. Let's examine how Suboxone interacts with other drugs. Suboxone, much like any other medication, can interact with other medicines and may cause mild to severe side effects. Though Suboxone is significantly safer than methadone, the slightest chance of misuse can derail your sobriety. Consulting with a Suboxone doctor is crucial. You must inform them about the other drugs you are taking to help prevent severe side effects. Suboxone can have an adverse effect when mixed with benzodiazepine, like Xanax, Valium, and Restoril. Cocktailing your medication is a definite no-no in any case, let alone Suboxone. Combining Suboxone with other drugs can result in slowed or shallow breathing, fainting, or unconsciousness. If this occurs, immediately seek emergency medical help. Consulting your Suboxone doctor is vital to understand the Suboxone half-life, which is the time it takes for half of a dose of Suboxone in your blood to be eliminated by your system. Suboxone has a ceiling effect. It means there is a maximum dose, and taking more Suboxone will not result in any significant effect. One of its active ingredients, buprenorphine, will give off a certain degree of feeling for pain relief, but at a steady rate no matter the amount of dosage. This ceiling effect is due to its other active ingredient, naloxone, which blocks the effects of opioids. Knowing this is crucial to avoid taking too much of the medication. Abusing Suboxone will not make it work any better and could potentially lead to an overdose. In the rare chance a Suboxone overdose occurs, knowing what to do and acting fast is crucial. The first thing you should do is immediately call emergency services and follow their guidelines. After that, remain calm as possible while waiting for medical help. If the person who overdosed on Suboxone is not breathing, it is critical to start performing chest compressions, also known as CPR. If you are not CPR certified, it is highly advised you still perform it until emergency responders arrive. The risk of overdose can be considered a grave threat to those dependent or addicted to opioids. While the risk is relatively low, knowing the risks and dangers of Suboxone is essential before starting treatment. Please contact us if you or a loved one is struggling with Suboxone addiction and needs help. We understand how difficult this time may be for any individual going through opioid withdrawal symptoms and dependence. We know that the time to act is now, and that there should be a quick way to get the help you need in the simplest way possible. At Suboxonedoctor.com, Our certified and compassionate Suboxone doctors will contact you as soon as possible to discuss the treatment options that best fit your needs and start your path to life after addiction. Suboxone is a highly effective medication for opioid addiction. Being wary of the possibility of overdose is essential. Though Suboxone has a ceiling effect and is significantly safer than other opioids, you should still use it cautiously and as prescribed by your qualified Suboxone doctor. If you or someone you know has overdosed on Suboxone, immediately seek medical help. At SuboxoneDoctor.com, we are here to help you manage your addiction and connect you with a certified Suboxone doctor as soon as possible. Visit us today and take the first steps toward your future free of opioids.